getting vaccinated. Definitely urge everyone to get vaccinated if it's offered to you, and hopefully everyone's staying safe. We are excited to celebrate actually and honor Parkinson Awareness Month this month with some offerings. I was on vacation a little bit, getting some self-care with my boys, and had some beautiful experiences in nature, and came back to realize that it was, we were knee deep already in this month, and I think we honor our patients and those who care for you and care about you tremendously. You're what keeps our hopes and dreams alive to find a cure, help you live better lives, improve your quality of life, and hopefully, we can bring some insight into, this complex disease that we're all trying to understand better. So with that, I will introduce our speaker, who I'm actually really excited to introduce to you. I have been really interested in the concept of trauma and mind-body connections. I've been working in the yoga and mindfulness space and learning about trauma, trying to understand that as pertains to Parkinson's disease, and understand sometimes how physical feelings can affect mental feelings and connections. The brain is, ever interesting to me, and I'm so actually excited that I went into neurology. It was the right choice, because I'm a very kind of I love the brain, and I think it's so complex. So I think I'm happy to introduce Drew Petkus, who is actually relatively local to me. He's at our rival institution, USC. He got his PhD at the University of California in San Diego. And then he's actually married to another presenter who we had just in the last month as well, Megan Gomez, who's this fabulous psychologist who works at the Long Beach VA, and she gave us a beautiful talk on caregiver support and issues in Parkinson's disease and caregivers. So definitely recommend that you tune in and check out that, and maybe Andrea can link that here. And she was, I work with Megan at the VA, and she introduced me to her husband, who is also involved in Parkinson's. He works with Giselle Petzinger. He's actually lived across the US. I think he said that he had got his undergrad from Oshkosh, Wisconsin, which I've never visited, but apparently there's an Oshkosh B'gosh factory there, and maybe he can tell us for a second where is home for him these days. And then also he spent some time in Southern Florida learning about gerontology, actually, which I think is so applicable. So he has this really amazing kind of background to beautifully complement this topic on trauma and Parkinson's disease. So Drew, maybe tell us a little bit about what inspired you to, I think you're from Wisconsin, maybe from just talking to you, to leave Oshkosh and then make it down to sunny Southern California.
Right. So I'm from I guess I grew up on the Illinois-Wisconsin border, so kind of close to Wisconsin. I kind of identify more as a Wisconsinite. So, but yeah, I got my bachelor's degree in psychology, and I just really grew this really love and interest in working with older people. And so from there, I got my master's in gerontology to kind of learn more about the natural aging process and the kind of the changes that occur as we get older, and then focusing more in my PhD on the clinical geriatric psychology, so issues related to kind of getting older, and focusing a lot on anxiety, depression, and also some on trauma exposure, which I'm really excited to, and trauma's effects on emotional health. And I'm really excited to be here today to share some of to give this talk. Yeah.
Thank you so much. Well, I know you put together this amazing slide set, and I got a sneak peek at that. So without further ado, maybe I'll let you get into that. And then I'm sure, hopefully, I think that the audience is, I've seen a lot on Twitter about how excited people are to have this topic happen. So I think they will want to hear your talk, and then we can maybe do some Q&A afterwards.
Fantastic.
Go ahead and share your screen.
Sure. Great. Everybody can see the same slide? Okay, good. So yeah, like I said, I'm really excited to be here today to give this talk on trauma, cognition, and Parkinson's disease. Oops. So just a disclaimer, I'm not a neurologist. I'm a licensed clinical psychologist. So I may have a little bit of a different background than some of the speakers that you've had in the past. And then we're talking about something really sensitive, like trauma exposure. And so I just have a disclaimer about not sharing in this kind of venue about personal sensitive information. But I do have some slides at the end about things like if you've noticed or if you've experienced a traumatic event, about where resources and things that you could do to get help. To provide a brief outline of what I'm going to cover over the next half hour. So I want to begin by first defining what a traumatic event is and spend a little time about talking about how traumatic events may impact someone's risk for Parkinson's, as well as increase someone's risk for emotional distress, specifically disorders of like anxiety and depression in later life, and talk briefly a little bit about how trauma may impact our thinking ability. And then lastly, I think most importantly, I talk about what can you do to promote good cognitive and emotional health, and what are some things that have been developed to help people who are dealing with depression, anxiety, and trauma. So I'm just going to move this real quick. Sorry about this. There we go. Sorry about that. Okay. So a good place to start is by defining what I mean by trauma. So I'm a clinical psychologist, and I followed this manual that medical professionals, specifically psychologists and psychiatrists, put together called the Diagnostic and Statistical Manual of Mental Disorders. So this book is created by leading experts in psychiatry and psychology and provides consensus definitions of these various psychiatric disorders and these terms that we commonly talk about. So in this manual, there's a whole section on trauma and stress-related disorders. So here we define trauma as something, exposure to an actual or threatened death, incurring a serious injury or some sort of sexual violence. I think people, when they hear the word trauma and post-traumatic stress, which I'll define next, they think of military veterans and combat-related trauma. However, anyone can experience a traumatic event. And some examples, but by no means an exhaustive list of some examples of traumatic events, include experiencing a significant accident, like an injury, like being physically assaulted, a natural disaster, being in a motor vehicle accident, some kind of domestic abuse or sexual assault are also common traumatic events. And it's important to note that trauma can be experienced in several ways. So first, someone could directly experience one of these events themselves. Second, someone may not be the person experiencing the event, but rather witnessing this event, or witnessing this event happening to someone else, or witnessing someone incur a serious injury, or witnessing a motor vehicle accident. Third, learning that a traumatic event has occurred or a death has occurred to, or a serious injury has occurred to a close family member or loved one can also be considered a traumatic event. And lastly, experiencing kind of repeated or extreme exposure to aversive details of traumatic events may also constitute trauma. So this falls under the category of like someone like a first responder or a police officer who's repeatedly part of traumatic events like involving other people, such as repeatedly responding to child abuse or having to respond to other types of traumatic events. So what is post-traumatic stress disorder? Post-traumatic stress disorder is this development of persisting distressing symptoms that interfere with your life following the exposure to a traumatic event. So this constellation of symptoms that are characteristic of PTSD include these different criteria. The first criteria is that someone is exposed to one of these traumatic events, as I defined in the previous slide. Following this event, someone who has PTSD experiences some intrusive re-experiencing of this event. So what I mean by this is that someone who has PTSD has intrusive thoughts about the event that they don't want to have and are distressed about. So like intrusive memories about the event they can't get out of their head. Recurrent distressing dreams about the event are also common. Individuals may also experience something they call flashbacks, where they kind of feel as if they're back in the event and the event was occurring all over again. The next constellation of symptoms include this persistent avoidance of the traumatic event. This includes like avoiding talking about or places that are associated with the event, or really any kind of interpersonal interaction with other people, and so avoiding I'm sorry, or really any kind of avoiding any kind of interpersonal interaction that may evoke physical sensations, thoughts, or feelings about the event. And this avoidance can really take a toll on the person, and often contributes to someone maybe being really socially withdrawn from others, can contribute to depression and these increased negative and emotional kind of states. And importantly, this avoidance can reduce all the positive experiences, or really restrict that someone from experiencing positive experiences or emotions as well. And so lastly, the last core characteristic symptom of PTSD includes this feeling of this heightened physiological arousal that began or worsens after the event. And this includes maybe being irritable, angry towards others, being hypervigilant. So whenever you're going into a new situation, being really aware of your surroundings and everything going on. And it's a combination to have or feeling startled and easily having difficulty concentrating. Studies show that approximately 50 to 70% of people will experience some sort of traumatic event during their life. So the majority of us experience some, so the majority of us will experience some traumatic event during our life, and about 8 to 10% of people will meet criteria for PTSD over the course of their life. So there's some limited research suggesting that a traumatic event may directly impact someone's risk for developing Parkinson's disease. And there's really two ways that this might happen. First, as we described in some of these examples of traumatic events, someone may experience a concussion or hit their head really hard, which may directly, there's some evidence that like a TBI or that direct brain injury may impact someone's risk for Parkinson's. But other examples include the stress related to prolonged stress may also exert a negative impact on your brain, which may put you at higher risk for developing a neurodegenerative disorder like Parkinson's disease. But I don't really want to, I'm not spending much time, I don't want to spend too much time in talking about the link between how trauma can impact your risk for Parkinson's disease. But there's some studies that suggest this, although most of the research is a little bit mixed in this area, I would say. And it's a hard thing to study as well. But I do want to focus on one thing related to distinguishing PTSD and Parkinson's disease. And from hearing stories from patients who are in settings where PTSD is quite common, so like in veterans and the VA, where the rates of PTSD are relatively high, I hear that oftentimes people are misdiagnosed originally as having PTSD, but they really have Parkinson's disease, which when I first heard that, I was kind of surprised, but then it really makes sense. If you look at a lot of the common symptoms of PTSD and Parkinson's disease, there's a lot of symptoms that are in common. So like the trouble concentrating, sleep problems, nightmares, rumination, intrusive thoughts, the anxiety, depression, that social withdrawal, and that hyperarousal are both common things that occur in PTSD as well as in Parkinson's disease. So it can be kind of hard sometimes, I think, to distinguish if someone has PTSD or Parkinson's disease, especially in a setting where there's really high rates of PTSD. And I think some of the distinguishing things or the factors that distinguish PTSD and PD are PTSD's starts as a response after a traumatic event, and experiencing these daytime flashbacks versus which is kind of unique to PTSD. Versus in Parkinson's disease, of course, is a neurodegenerative disorder, and then the motor symptoms of Parkinson's disease. So that brings me to kind of now wanting to review how trauma can be associated with our emotional and cognitive health, and how trauma can contribute to symptoms of emotional distress, such as anxiety, depression, and also potentially impact our cognition and our thinking ability. So when I talk about things like depression and anxiety are more than just feelings, right? So I think when someone hears the word depression, they think they automatically, first thing they hear is sadness. And someone when hears the word anxiety, they think of that, that feeling of being nervous. But both anxiety and depression are much more than just emotional feeling of sadness or nervousness. So as a psychologist, we break down anxiety and depression into these different components. So for example, in depression, there are certainly the feelings of sadness that are the hallmark symptoms of depression, but there are also these physical symptoms that occur with depression, such as feeling fatigued, difficulty concentrating, like the slowness or slowed thinking or slowed moving. Thinking may also be impacted in depression. So people with depression, if you always hear the analogy, like the glass is half full or the glass is half full or glass is half empty. People with depression tend to be that glass is half empty type of thinking. So like this negative type of thinking patterns where people tend to be maybe a little bit pessimistic about things, or kind of have like a negative view about the world. So when we were depressed, we kind of have these negative types of thinking patterns. People with depression also tend to experience something we call rumination, which is this kind of replaying events that have occurred in the past. And lastly, there are sorts of behaviors that are common in depression, such as wanting to withdraw from our hobbies, our social situations. And as you can see from the slide, I have these double-sided arrows connecting all of these aspects of depression, which I'll give some example. I'll give an example of this in a few slides, but this highlights how all these aspects of depression are connected, and that really these negative cycles can emerge where we kind of get stuck and we can get kind of stuck in these negative cycles, and it takes us away from like living our life or really wanting to, or moving towards like the things that are most important to us. And I want to spend a quick moment delineating or distinguishing between what is a feeling versus a mood and a disorder, because I want to highlight that both anxiety and depression are normal experiences that we all have, and they're really adaptive experiences as well. They're adaptive emotional experiences, that we've developed as humans through evolution and are adaptive for our survival. So for example, like sadness is helpful for people, I think people hear sadness is helpful for us, but sadness is really a helpful thing for us, and it conveys to like our social networks that we need help, and it elicits social support from others. Also, people with depression, like I was saying, they tend to have more negative thought patterns, but that negative thinking, there's been some studies that show that people with depression think kind of somewhat more realistically about outcomes and things. So although they're negative, sometimes that negative thinking is actually maybe more realistic and kind of a different perspective that could be really helpful for people to get like an alternative perspective on things. Likewise, anxiety is really helpful to motivate us. So if I didn't have some kind of anxiety about today's talk and sounding like a doofus in front of everybody, I would never have been motivated to put together these slides and practice what I wanted to say today. So anxiety is good because it helps us motivate us. When I talk about feelings, it's kind of like what I'm experiencing right now in this moment. So either I'm sad, I'm happy, I'm anxious, I'm scared. Mood is kind of something that's more prolonged. So I'm having a bad day. I've been nervous all week about this deadline that I have to do. It's kind of like a prolonged feeling, but moods are also normal. It's normal to be in a sad mood or happy mood or anxious. But when we talk about disorder, what's considered generally a disorder is when these negative emotional states persist for like a long period of time, or they interfere with our life. So someone who is so anxious that it's like impossible to make decisions, or you're procrastinating about really big decisions, and you're procrastinating by watching TV and putting off some really big decision, or you're feeling so sad it's hard to get out of bed, or so anxious or depressed that it keeps us up at night. That's kind of where we would say that that's more of a disorder versus a feeling or a mood. So these negative cycles of depression and anxiety can emerge. It can result in really disrupting people's lives and work towards their goals and values. So I'm going to provide an example here. So for example, this is one I've heard a lot with working with people with Parkinson's disease. So like my Parkinson's disease medications are starting to wear off. So like those physiological symptoms that you may experience when the medication's starting to wear off, that such as maybe increased shakiness, heart rate. So you notice these physical symptoms that are starting to occur after the medication starts to wear off. And especially with someone with like a trauma history, this may prompt someone to feel like, oh, I'm feeling like this reminds me of how I felt when I was experiencing this event that happened in my past that was really upsetting to me. So I have this feeling, it reminds me, it's kind of have the same feeling of what I felt like before. Oops. So this then leads to these thoughts running through your head. I'm in danger. I'm going to be stuck here. Something bad is going to happen to me. I'm in trouble, which then may lead you to wanting to scan your environment, to look for dangers, or scan the environment to look for your medications, starting to breathe heavy because of just the physiological arousal. So now you're breathing heavier, you're looking for your medications, which then could even increase your heart rate higher, start sweating, which then could lead to anxiety. And then we can continue how this cycle can just kind of start spiraling. Like if you're in a situation that you really you're engaged in some activity, like in something that you really wanted to do, like you wanted to go spend some time with your grandchild, or you wanted to spend some time with your family, and now all this is going on and it results into you saying, I need to go home. I can't be here anymore. So then you go home, but then you start feeling sad afterwards because now this event, you didn't get a chance to do this thing that you really wanted to do. So this is kind of an illustration of how like these really nasty cycles can emerge and really can kind of impact our ability to carry out the things that we really want to carry out and are important for us. So anxiety and depression are very common in Parkinson's disease. So about 10 to 15% of younger adults experience some problems with anxiety and depression. Actually, as we get older, our rates of anxiety and depression go down. So older adults experience about 5 to 10% of older adults experience some anxiety and depression. But you can see with people with Parkinson's disease, this is quite common. In about 40 to 45% of people with Parkinson's disease will experience some problems with anxiety or depression throughout the course of Parkinson's disease. So you can see it's a really high number, percentage of people with Parkinson's disease and experience problems with anxiety and depression. So it's a very common thing to experience. So what causes depression and anxiety? So now, again, to tie this back to trauma and how experiencing a trauma may increase your risk for anxiety and depression. There are three main factors that go into anxiety and depression, or thought to go into someone's risk for anxiety and depression. First, there are genetics and physiological factors that are important. Studies with twins suggest that, genetic studies can suggest that about 30 to 40% of someone's risk is already explained by genetic factors. So there is a strong genetic contribution to experiencing. So some people are just biologically more likely to develop anxiety or depression. But there's also other physiological factors that are important, especially related to Parkinson's disease. So trauma. So one thing is dopamine. So dopamine is really important for positive mood and regulating our emotions. So the physiological changes of the decreasing dopamine is thought to be one factor that may impact or increase someone with Parkinson's, their risk for developing depression. But trauma can also play an important role with our physiology, especially traumatic events experienced earlier in life. So studies show that if you compare the brains of adults who are exposed to more adverse childhood experiences, like emotional, physical, or sexual abuse, to adults who didn't experience any of these events, the adults who experience these adverse childhood experience, their brain actually looks different when you take a picture of their brain with like neural imaging. specifically people who experience more adverse events tend to have like this heightened physiological response to stress, and that stress area of their brain looks a little bit different than, and it's thought to be shaped by just these early experience can actually change some of the physiology in your brain. And these physiological changes may make the person more vulnerable to subsequently recurring problems with anxiety or depression. Other early life experiences are also really important in terms of like learning coping skills. So early life experience is characterized by this consistent environment that is positively reinforcing and safe, is something that's really protective against the development of anxiety and depression in later life. For like more chaotic early life environments or these adverse childhood experiences can exert this psychological effects on individuals, such as like individuals who experience more of these events may learn through, these are learning events where like people learn that the world is unpredictable, the world is unstable, and they also may not learn these adaptive mechanisms to cope with stress. So this results in potentially feeling powerless to deal with problems when they come up later in life. And then lastly, our current stressors and environment play an important role in anxiety and depression. So current environments that are characterized by a lot of stress may increase our depression and anxiety. Someone with a trauma history, as already discussed, may be more likely to be socially withdrawn or have low social support. So then later in life later on when there's more stress, that person might be at higher risk for problems is because they maybe not have the social network or other social resources to kind of help them cope with like stress or anxiety or stress when it comes up. So now to go on to cognition. So stress can negatively impact our thinking ability. So when I talk about thinking ability, I'm just going to broadly talk about like our memory, our ability to focus, or broadly just think our ability to kind of engage in our life values, the things that we want to engage in. We really want to spend our cognitive energy on these life values. So like our health, career, are these things that are most important to us. Unfortunately, stress and post-traumatic stress and disorder and anxiety and depression can negatively impact these. So if you think about it, we have like this cognitive gas tank here, and ideally we would spend all this cognitive gas tank on our life values. But what happens is like if we first with Parkinson's disease, things become we have to spend a lot of our cognitive energy on Parkinson's disease. So things that maybe we didn't really have to think about, like walking around or walking to our car or going over a curb or navigating or tracking a conversation. Those things maybe become less automatic. So we're spending some of our cognitive gas tank on those things that are impacted by Parkinson's disease that maybe were previously were more automatic for us. And then if someone has a trauma history and are experiencing problems related to post-traumatic stress disorder, that kind of takes away even more of our cognitive gas tank, because now we're thinking about things related to this a traumatic event that maybe has occurred before, kind of the hypervigilance that I was talking about, or experiencing these intrusive thoughts about the past. And what that does is kind of takes away some more of our cognitive gas tank. And then if now I'm feeling sad or down, or I'm ruminating about things that I wish about things that have in the past, that's even more of our cognitive gas tank. So what happens is then we have less of our cognitive gas tank to really apply to like our life values and things that are most important to us. And then there's some studies that show that there may be a risk for people who have high stress, like PTSD, might increase your risk for clinically significant cognitive decline, such as dementia. So how can like something like PTSD increase our risk for dementia? Or for subsequent cognitive changes? One is just that, again, the effects of this prolonged stress on our brain, our brain exerts some hormones when we're feeling stressed, and there's some thought that those hormones over time can, if we have high levels of stress, that can actually damage part of our brain that is important for like learning and memory. But other things that can impact our related to stress can impact or maybe contribute to our dementia risk. So one, if I'm feeling stress prolonged, it's likely that I might engage in, we often engage in activities or things that might in the moment take away our stress, like stress eating. So eating really bad foods because it makes me feel better, kind of relieves that stress for a moment, but then it might contribute to some health problems later on. Or alcohol, drugs, tobacco, those things can kind of alleviate or kind of give us a relief from that stress in the moment, but then over time those things can have negative impacts on our cognitive health. PTSD can contribute to some of this relational distress, which then can kind of cause stress in other aspects of life. And then, like I said before, loneliness is a common symptom, and like that social withdrawal related to PTSD. And we know that people who are more connected socially tend to experience less declines, and it seems to be a protective factor against subsequent declines in thinking ability. So that could be another way that PTSD can increase our risk for declines in thinking ability. So now to get on to the last part of the talk, and I think the most important thing is like, what can you do? So what can we do to promote good cognitive and emotional health as we get older, and in people with Parkinson's disease? So first, I want to go over these lifestyle factors that are really important and associated with cognitive and mental health in later life. So first is sleep. Practicing good sleep hygiene, such as like trying to go to bed at the same time every night, avoiding like bright lights, caffeine before going to bed, and other factors and other things that have been shown to kind of promote good sleep. That we know that people who sleep well it's correlated with good cognitive health as well as with mental health. Avoiding alcohol, drugs, and tobacco are things that tend to be associated with, are definitely associated with good thinking or thinking ability, as well as good psychiatric health. Trying to be social. So I know some of these things are especially hard with everything going on with COVID, but trying to be connected to other people and being connected to other people, and that social connectedness is something that's protective against declines to thinking ability. Taking care of your head. So trying to avoid any kind of injury to your head. We know that people who have experienced these traumatic brain injuries or concussions, that could be a risk factor for declines to thinking ability in the future. So protecting your head, and also basic getting your hearing checked and vision. So making sure that you go to the eye doctor on a regular basis, as well as hearing, and wearing hearing aids is important. Because again, if you're having trouble with the kind of basic hearing, then it might impact your ability to carry out other more complex types of thinking abilities. Managing stress is another one. So kind of reducing the amount of stress in your environment is I think important for maintaining good cognitive and mental health. Exercise is important. So to not only managing symptoms of Parkinson's disease, but also your thinking ability and mental health, and on your brain health. So being physically active and exercising is important, as well as similarly kind of managing that heart-brain connection. So we know that people who have history of vascular disease like hypertension or high cholesterol, those people are at higher risk for declines to thinking ability, as well as increased risk for depression in later life. So managing those vascular diseases or vascular, basically whatever good is for your heart is whatever is good for your heart is also good for your brain. So kind of keeping those things monitored and treated is really important. So to kind of simplify that message into one slide. So I always tell people to kind of stay engaged in these 4 domains of life. So being physically active, so staying engaged physically in your life is important. staying engaged cognitively. So keeping engaged in whatever that is for you, whatever is cognitively stimulating for you, what is important. I always get the question of like, should I do crossword puzzles or Sudoku? I think if you really like crossword puzzles and Sudoku, then that's a great example of maybe something that kind of keeps your mind going. But if you really don't like those things, then it's kind of on an individual basis as whatever's cognitively stimulating for you. And staying socially engaged is really important. And then whatever being spiritually engaged, whatever that means for you, is also really that are all things that are correlated with good mental health and good cognitive health in later life. And I said at the beginning of the talk, I hear some great resources to kind of learn about anxiety, depression, and trauma, and anxiety, depression, trauma, and cognition. So the PMD Alliance, the Anxiety Depression Association of America, and the Parkinson's Foundation all have really great resources to kind of learn more about these things. And if someone's experiencing some of these problems related to anxiety, depression, or PTSD, there are a lot of medication, there are a lot of treatments that have been shown through research to be helpful for kind of coping and kind of overcoming those things. Some of those medications are like SSRI medications, benzodiazepines are also, but those should be really used with a lot of caution, especially with people with Parkinson's disease. They increase the risk for falls and other and really adverse side effects. So my recommendation is to really, if you're interested in kind of medication, to talk with your neurologist, primary care physician, or psychiatrist. But I just want to highlight that there are medications that have been shown to be helpful for people, as well as different psychotherapies. So the one psychotherapy kind of works on building on that example that I showed before, how these negative cycles can emerge. Cognitive behavioral therapy, which basically helps individuals identify these cycles as they emerge in people and yourself, and then kind of giving you tools to kind of break that cycle when you're feeling that it's playing out, different ways gives you tools of different ways to behave or think about, or so that cycle is broken. And then mindfulness meditation is something that's been, a lot of research has been recently looking at how mindfulness meditation can help with things like anxiety and depression. And there's some treatments or psychotherapies that have kind of meshed some of these mindfulness meditation with other types of psychotherapies. And one that in particular that has been given, as a lot of attention for like post-traumatic stress disorder, is this acceptance and commitment therapy, which is a type of therapy that kind of melds this mindfulness meditation and more of this like behavioral approach. But with that, that kind of wraps up my talk. I just want to acknowledge and say thank you for your attention, and I'm happy to answer any questions. We have about 20 minutes for questions. Perfect. So yeah.
Yeah, that was amazing. Well, that's so sweet that you thanked Megan as well and Dr. Petzinger. So maybe just stop sharing so we can have a look at your lovely face there. Yay. Okay. That was great. I mean, I think it's such a complex topic, but I think it's really, not had any press at all. I think when you and I connected, Drew, I had done a quick search or two to see if we could, find any data on Parkinson's and trauma. And, outside of just head injury, traumatic brain injury, there's not a lot out there. And so I think, thinking about how previous life events can impact how we get into these sort of vicious cycles, I think is actually very helpful. And one of the things that I think I've been spending a little time on is the sense that COVID, because of, this, we're societally, I guess, globally, we're all going through this trauma together, like other major, events in the world, like a world war or something else, is impacting all of us in our own ways. And I think we're still in the middle of it. So the sense that you can't really predict the future 100%. It sort of harkens to, I think, some other times when people have been struggling. And I think a lot of my patients have felt, not in control, in a sort of sense that then their sort of mind goes to bad places, and then their physical symptoms then mirror that, and they get out of their normal lifestyle routine. So could you speak to the sense, when you wrote about what defines a traumatic event, does COVID fit in that sort of definition? What's your sense of what we're experiencing now?
Right. I mean, I think COVID can exacerbate, a lot of these, like what you exactly were talking about, like motor symptoms and some of that emotional distress, because that feeling of like that uncertainty about what's going to happen in the future. I think people could have like a traumatic reaction to just COVID, and then, or it's kind of, I don't know if it would fall into the category of a traumatic event, just because as that the definition, just because it's such a long event. But I think but I definitely think it is a significant stressor that people are experiencing. And I know it's hard because all the things that I have on that list of lifestyle things, about things that you could do to help yourself, that we know are correlated with good thinking ability and emotional health, most of those things have been impacted by COVID. So it makes it really hard, like the social, like the being connected with others, exercising, all those different things are impacted. So, and I think like someone who may have a past trauma history, like COVID could be particularly, really hard, particularly hard, just because we know that like that uncertainty, kind of feeling helpless, like people who have, I think one common thing with people who experience trauma is that we kind of want to have control or control over everything. And then that lack of control, I think, can be really hard. I mean, it's hard for, I think, a lot of people, but it can be really hard for someone who has a history of trauma or anxiety.
Absolutely. So one of the questions Maureen asked here, is there any evidence that the time frame of PD progression changes when a traumatic event occurs? Do we have evidence of that?
I think I don't know if there's too much evidence that it like impacts or accelerates the PD progression. I think when I was with the studies with the head injury, like the TBI, I think if there's some thought that like if someone has experienced like a traumatic event, maybe where they also have a traumatic brain injury, that might kind of accelerate the PD process. But I don't think that there's really, to my knowledge, like strong evidence that like a traumatic event will accelerate something.
Yeah, I think that I don't know of any of it. I mean, honestly, there hasn't been good research in this area at all, from what I can tell. And I agree. I think maybe if you had a physical trauma to your head and perhaps passed out or something, it was significant enough that you end up going to the hospital or something, one could envision that you could have, exacerbation of symptoms. But it's otherwise, again, not a lot of research out there. I know that you were telling me about a study, Drew, that you had done looking at past history of trauma and the sort of cognition, and how if somebody's on a timeline to get I guess the sort of worsening of cognition, that trauma can affect that sort of timeline, right? Could you tell us a little bit about that?
Sure. So this is actually my master's project way back about 8 years ago. So what I did was we looked at data from this this wasn't in people with Parkinson's disease. It was a large study from Rancho Bernardo, California. I don't know if you're familiar with this large epidemiological study where they followed this about a couple thousand people in Rancho Bernardo, California, which is a suburb of San Diego. It was a study looking at heart disease and risk factors for heart disease, but then they also asked some questions about trauma history. And we found that individuals who reported a prior history of sexual assault, and it was primarily like in adolescence, they experienced more rapid declines to a type of thinking ability called executive functioning. And this was in their 60s and 70s. So executive functioning is like this more complex type of thinking ability, like when you're like solving problems or multitasking, we rely on executive function. And it's interesting, it's probably the most commonly impacted cognitive ability that's impacted in Parkinson's disease. But we found that, yeah, individuals who experienced or reported experiencing a sexual assault at some point in their life, but it was primarily looking at adolescents, that they experienced more rapid declines. It was about 50 years later in their 60s and 70s.
Wow, that's
Yeah.
really amazing, right? I mean, I think that something that happens that early in life could impact, something later on. There's a question here about, so you had mentioned, I think, about a child would be more negatively impacted by a traumatic event than a 65-year-old because we build resilience as we age. Was that the sense that sort of you learn techniques to deal with trauma as you go?
So in terms of how a child might be more impacted by like a traumatic event, I think children may be really vulnerable because, like, one, we're kind of learning about the world. So like if we're experiencing a lot of traumatic events as children, we kind of form our worldview and our coping strategies. I think that traumatic event can really impact our ability to kind of how we learn about the world when we're as a child versus someone who might experience a traumatic event for the first time later in life. It could still definitely impact you, but like it might not, our worldviews aren't really being formulated and our brain isn't growing and changing. I think that's the other aspect of when you're a child, your brain is still developing, and that stress can really impact, I think, how your brain develops or as a child. But yeah, but I think it can definitely impact you both as a older person and as a younger person. But I think a younger person, especially like their formation of their brain, might be very particularly vulnerable.
Yeah, it's such an interesting area because I think as brain cells are degenerating too, some of the sort of ways that the brain is able to cope may also be affected. So I think, some of these traumatic experiences later on, we're sort of seeing some populations of patients that are, able to be resilient to a point or have a lower threshold than in a COVID setting, for example, to handle the stressors because, they may have not so much reserve. So I think these sort of areas, I think what are fascinating are the sort of early childhood arenas and probably even later in life when, as you're studying the sort of gerontologic sort of aging process is also probably a little bit of a risky time, which is why I think anything you can do to kind of get these behaviors in early on in the disease and to understand like this type of lecture where I think many people don't even, even these healthcare providers don't know enough about Parkinson's to realize that it's not just a motor disease, that it does affect non-motor issues. And in the non-motor realm, it affects, cognitive function as well as anxiety and depression. There's so many people and many patients that walk in my door that don't even know that. And so once you, I think, connect these dots and then realize that, as you've mentioned so beautifully, that there's lifestyle modifications that you can kind of drizzle in, hopefully early on, to learn mechanisms sort of to prevent sort of these things from happening or to cope better, I think is really interesting. Somebody here asked about, just could you repeat the advice about hearing aids and glasses and cognitive health? I think they missed that point.
Oh, right. So we know from studies that people who are experiencing changes to their hearing or vision, that's a risk factor for subsequent cognitive changes. So I think one thing is if you're try to to get regular checkups to make sure that for your hearing as well as vision, and using any kind of assistive devices like glasses or hearing aids, I think are important. Yeah.
So Judy asks here, there's mixed research-based information out there about the use of EMDR, so that's eye movement desensitization retraining to address exposure to trauma. Are you aware of any positive or negative implications for the use of EMDR with those who have Parkinson's disease? Is that something that you've had experience with, or?
That's a good question. So I know what EMDR, I know what EMDR is. I don't have any experience doing EMDR. But I'm not aware of any kind of contraindication that someone with Parkinson's disease would be of contraindication of EMDR with someone with Parkinson's disease. Yeah, I'm not sure if I'm not aware of any.
I don't know enough literature on that either. I don't know if it's been specifically studied. We could definitely look, but I know even just some of these things are new, and they're they are teachable in courses. I don't think they require necessarily one-on-one work with the therapist. So I think that is somewhat interesting, I think, to make things accessible. On that note, Drew, I know that we've talked a little bit about CBT before. I know that so many algorithms talk about, and end up from at least a psychiatry perspective, talking about CBT, so cognitive behavioral therapy, which my understanding is either you do one-on-one with a therapist or sometimes in a group with a therapist guiding. I know that therapists are really in short supply these days. I think, could you, and I think you posted the Psychology Association, American Psychology Association website, right? But if people can't get access to that, let's say they're in a country that doesn't have therapy like that, CBT like that, are there some sort of cheaper resources or books or something, some way to take what you learned from CBT and apply it on a daily basis?
Yeah, that's a great question. So I think I know there are like self-help books that kind of teach CBT, or like that acceptance and commitment therapy approach, which is a kind of a newer approach. Like one in particular that teaches like this acceptance and commitment therapy. It's like more of a self-help that you kind of go through it yourself. Is something called like Get Out of Your Mind and Into Your Life. It's a really good self-help book. But there's also different CBT kind of tailored self-help books. I'm blanking on like specific names other than that other self-help book, which I often refer people to.
Yeah.
But yeah, there's definitely a lot of resources out there. And I think on that Anxiety Depression Association of America, they have, there's a lot of good, really great resources that
Yeah. I think, and the other project that you and I have been talking about, and we'll have you involved in with the PD wellness kind of resources, we're hoping to link some of these things for folks that don't necessarily have access or are waiting to get therapy. I think at the VA, we've been relatively lucky to have access to therapists because, that's just how it's set up. But I know it's quite costly and cost prohibitive for other folks. And I think, I know some of the therapists that I know need therapy themselves because they're so overstretched right now. So I think if there's ways to kind of break some of these things down a little bit to help patients, but I think just seeing that beautiful schematic that you wrote of the sort of cycle of rumination where you have something that invokes a memory of something else, and then it leads you down this sort of space where, it ends up becoming kind of bad news and you just kind of get into this negative place. I think just seeing it written out like that in an example, I think is very helpful. And I think it's resonated with some of the audience here. Somebody asked about music and singing, if you have any sense of that in terms of helping with some of these sorts of issues as sort of a way to, you had mentioned exercise and these other approaches.
Yeah, I think music and singing could be really helpful. I think I think one of the most important things is finding like those things that are like pleasurable for you and like really give you anxiety, kind of reinforcement, and positive reinforcement and excitement, and are really important to you. So like if like you really love music, love singing, I think those are like great examples of like how engaging in music or playing music or listening to music or being around others while you're listening to music or singing can provide like a really rich, positive and great activity where you can feel connected to each other and having that positive reinforcement and pleasant experience. So yeah, I think those could be really important things too.
Yeah. And I think, whatever brings you joy. I think you talked about, something that, like we always say about these puzzles. I think if you hate it, like, don't do it. I think figure out what you enjoy. In fact, I think Mike Oken had posted something about, watching a movie or something with a family member and then talking about what you learned from the movie. So it could be something, more enjoyable, or a book club, like listen to books on tape and then talk about it with a friend. I know that I've been connecting about things like that. So it doesn't have to necessarily be something so prescribed and in a box and mundane for some people. And some people, they love that kind of stuff. So, everyone's very different. I wanted to give you just a couple of minutes, Drew, to give us sort of in this, World Parkinson Day was yesterday, and Parkinson Awareness Month this month. And I know you're in a Parkinson's aware family. Your wife's granddad had a Parkinson's, and I know that it's inspired both of you to do the careers that you do. And I can't imagine dinner at your table talking about this day in, day out. My husband's a radiologist, so we don't talk about this all day long. But I mean, I think it's fabulous that both of you inspired each other, and really, it's all in the family. So maybe just as a couple minutes of a message of hope to the group here, when we look to the future of this year to come, and what we've had to as a group have to go through this year, with the pandemic and things like that. Just give us some message of hope and inspiration maybe to the group.
Yeah. So yeah, because a lot of the things I kind of talk about, anxiety, depression, trauma, are really kind of negative, or can have, like, it can be hard things to talk about. I think one thing about hope is that a lot of people who do experience traumatic events, there's a whole body of literature which I researched that I didn't really talk about, but it's related to like post-traumatic growth. So like how we can grow from trauma, experiencing traumas, or like because I think the things that really challenge us the most, we tend to have the most growth from. So although like this last year has been really challenging with everything related to like social distancing and like COVID, and I think we can also think about how we grew over this last year, and how this last year is, I think, making a lot of people stronger despite all this stress too. So kind of trying to identify how I think a lot of us have grown despite despite all of this stress. So kind of maybe I'm thinking about more of like, how did I grow over this last year how did I overcome? I overcame all of this, and I'm here, and now I'm a stronger person. So I think that's one thing that it's kind of important to think about how.
Absolutely. And I think on the continuation of that theme, the post-traumatic growth, I guess is the word they used. Some people have said that, getting the diagnosis of Parkinson's was a life-changing event, and it was something that they almost had to grieve through, or it was a bit of a traumatic experience, especially when they've, been given it by the wrong person, maybe to sort of, be the entry to this, sort of life-changing event moving forward. Have you seen post-traumatic growth? And maybe you could just speak to that in the last minute or two, of people getting the diagnosis and then living, sort of a different life or a better life afterwards.
Definitely. I can think of a lot of people that I've worked with who maybe didn't have much direction in their, or maybe they felt like they lacked direction, and then getting this diagnosis of Parkinson's disease, and then focusing a lot of their energy and efforts and teaching other people, and outreach to other people, and trying to help other people through like support groups. I know I can think of a lot of people who have been part of our studies and who I've interacted with clinically, where like Parkinson's was kind of something that kind of helped them focus and their energy and want to help other people. And so I think that's definitely because yeah, you're absolutely right. Getting Parkinson's disease is kind of a traumatic event itself, and yeah, so I definitely have seen that, and yeah, I think that's important. Yeah.
Well, thank you so much, Drew, for spending the time. This has been really, kind of a game changer, I think, in terms of my thoughts about how Parkinson's, can be affected by these things, and how we can kind of work towards, focusing on the positives. And I think your wife, Megan, also had me think anew about, the role of caregivers too, and seeing that as giving purpose and meaning to the caregiver role as well. So I think sometimes the framing of some of these sorts of seemingly negative, life-changing events can sometimes really reframe. And I continue to be extremely inspired by our patients every day and their caregivers, and it gives me meaning to care for this population as for you too. So, thank you for joining us, and I'm going to hand it back to Andrea, and we'll continue to have great offerings, including Mike Oken, who is a real cheerleader and game changer himself, on Wednesday to talk about sort of where the field is going, what he sees, you know, the important things that we should be focusing on to impact Parkinson's patients as well as their loved ones. Andrea, I'll hand it back to you.
Yes, so Dr. Petkus, we always show our gratitude and get a little few seconds of eye contact. I invite everyone to turn on their camera. And Dr. Petkus, if you scroll through, just sending our gratitude for you joining us with a goodbye wave. So good to have all of you join us, and thank you again, Dr. Petkus and Dr. Subramanian as well.
Bye. Thank you.
Thank you all.